Homeopathy mainly believes in the etiology of the disease, how the disease started, where it started, and what are the phases it has passed during its progress. One such remedy in homeopathy is called phosphoric acid. Phosphoric acid we give for any kind of physical ailment that has resulted due to prolonged mental grief. So, for prolonged mental grief, we have many other remedies like lycopodium, natramur, ignatia, staphysagria, etc. How to differentiate phosphoric acid from the other remedies? Kent writes in his Materia Medica that mental pathology of phosphoric acid usually precedes before the physical ailments. However, Philip Bailey writes in his book of Homeopathic Psychology that there is another phase in between the emotional trauma and the physical level, that is the intellectual impairment. So, in case of phosphoric acid, the physical ailments appears in the third stage, first being the emotional trauma, second being the intellectual impairment, and third is the physical ailments. Now in the emotional trauma, what do we find? When we ask the patient of a diabetes or a prolonged diarrhea case or the numbness of extremities, etc., we inquire into the past, how did it start, etc. When we inquire into the past, we find there is an emotional trauma. It can be a grief, prolonged emotional period of mental stress, or it can also have started after he is being separated from home. We find the rubric homesickness, phosphoric acid is a good remedy. Or he is separated from a loved one, from his loved one, or any of his partners or family friends, or from his relative, close relative. After the separation, the emotional trauma might have started. And he undergoes a period of emotional stress, then it is followed by emotional numbness. For example, a boy or girl leaves home for higher studies. For the first time he goes out of house to stay away from parents. For initial days he will be missing the parents terribly. But after some days he becomes numb. That means indifferent, no emotional feeling. The parents may say that now our child is mature enough to understand, but the fact may be that he is now emotionally numb. So when the emotional numbness is there, the patients, they come and say, we are doing our everyday work, but we are not involved mentally into that. We are working as if we are in a dream. That is called emotional numbness. So the emotional trauma followed by emotional numbness, this is the first phase. Then after some days you may find the intellectual impairment, that is the second stage. Intellectual impairment means he may start forgetting the things. Of course he is an intelligent person, but while talking he suddenly gets that his thought process is freezing. His thought is vanishing in between. So this is called intellectual impairment. He is quite intelligent to recognize this fault of the mind. And then, because of this, he gets anxiety. Anxiety of what? Kent writes, anxiety of future. It's not that what will happen to my family members if I die, if I become workless, then how my family will run, children, wife, what they will do. It is not about that. This is the anxiety about the progression of the mental pathology. He says, doctor, my thought process are nowadays vanishing more. Am I going to develop Alzheimer's disease? Am I going to develop dementia? Where my disease is progressing, that anxiety keeps on coming in his mind. Because of this, he withdraws himself socially. He doesn't want to go to the social get-togethers, doesn't want to mingle with the relatives, because he has a fear that he will express this mental pathology in front of others. So he declines the invitations. Kent writes the rubric, inclination to sit. What does it mean? It means he wants to sit in one place, doesn't want to go anywhere outside, doesn't want to mingle with other people. That is the impairment of the intellect happens. After the second stage, you find in the third stage the physical ailments appear. Physical ailments appear can be diabetes, lot of fatigue, no interest to do work, no energy to do work, cramps in the muscles of the lower leg, increased thirst during anxiety, increased anxiety followed by diabetes, the grief followed by diabetes, the prolonged mental stress followed by diabetes. These are the well-reputed rubrics for giving acid phos for diabetic patients. So this is the third stage where we see the disease. So when the patient comes in the third stage with the disease, we have to inquire about the second stage and first stage in order to rule out the remedy of phosphoric acid. Philip Bailey says, two of the physical ailments he has come across mainly responded to phosphoric acid is, number one, the numbness of the extremities, one of the symptoms in the third stage, and number two, he says painless profuse diarrhea, loose motion, urging for loose